Our next patient is a 37-year-old lady who lives in the Middle East. She's been very conscious about her high forehead for many years and has decided to have a hairline lowering. So we're going to explain, as you can see, we've marked 3 centimeter hairline advancement. But before we start doing anything horrible, I'm going to inject some local anesthetic which will keep her comfortable during and after the operation. So we're going to show you how that's done shortly. Before we start the surgery, I like to wash the hair thoroughly so it tries to reduce any risk of infection. And certainly we've never had any kind of severe infections in all of the patients that I've done. So I think it works. Just make sure the hair is nice and clean before we start. Getting started now. I do a very zigzag incision along the hairline. You'll see when we come to close everything up that we're putting the zigzags back together so there's no straight line scar out along the hairline, which becomes very visible. People talk about doing an intratracheal incision, but I think I've tried lots of different incisions and I find that the zigzag incision like this takes me longer, but the patient gets a much better scar. So you just press on there for me, please. So it's worth the effort for the patient's sake. Now what I'm dissecting is below what's called the galea, which is this white fibrous tissue. It gives rigidity or a little bit of stiffness to the scalp. If you didn't have the galea there, the scalp would be like a floppy tummy. And so the galea gives kind of support to the scalp. So it's not. What I'm doing is what's called scoring the galea, which is just essentially incising the galea to release it. You can see how it opens up as I score it, and that allows us to expand the scalp and be able to bring the hairline forward. And the patients always will worry about does it thin your hair out? Well, yes, it does, because what we're doing is we're expanding the scalp at the same number of hair follicles. So the hair density does get a little bit less, but if you've got thick, nice hair like this, no one's going to notice it. You would never notice it. Your hairdresser is not going to notice it. No one's going to notice it. It's only if you've really got very thin hair that someone might notice it. Okay, suck on my side. Drilling the little holes for the endothelium implants, which are the little carpet grippers. You can have one on either side, and that's what holds the That's what holds the scalp forward so it doesn't slide backwards. Good. On the other side, so if you endothelium implant, it's made out of absorbable materials, so it will dissolve away after about 3 or 4 months, and it has these little spikes, which is what holds the scalp in place. So they go into the little holes that we've drilled. Perfect. The other side. Forehead. Again, doing the same zigzag incisions, so that when we put the scalp pad together, hoping that the zigzags will all match up. Where we've scored the galea and the little endothelium implants are there. I do put a little drain in. You can see a little drain down there. That'll come out before she goes home, before she leaves the hospital. Artis now. Before I do this, we're going to spray some Artis, which is a fibrin glue, into the scalp. It just helps us stick everything down, helps to reduce bleeding and fluid collection underneath the scalp. Just really, what I've found is really helps with the recovery. hand down there, press no harm. Stapler please. So I'm just closing up the scalp now with a fine suture which will need to be removed after 10 days. And you see I'm trying to put the little zigzags back together so we get the best possible scar for her. It's tedious stitching up, but again, it's for the patient's benefit, not for my benefit. I'm not doing it in a hurry because I want to get out of theatre, but I'm doing it to get the best possible scar.